Health information and basic medical statistics. Health information is a mechanism for the collection, processing, analysis, and transmission of information, organizing and operating health services, and also for research and training. The objective of a health information system is to provide reliable, relevant, up-to-date, adequate, timely, and reasonably complete information. Data and information. Data consists of secret observations of attributes or events. Information is the transformation of data by reducing them, summarizing them, and adjusting them for variations such as the age and sex composition of the population. Conversion of data into information produces intelligence. Data should be population based, should avoid unnecessary data, problem oriented, should employ functional and operational terms, illness, lab test, treatment. Brief and imaginative tables chart provision for feedback components of HIS, demography and vital events, environmental, health statistic, health status, mortality, morbidity, disability, and quality of life, health resources, facilities, beds, manpower, utilization and non-utilization of health services, attendance, admissions, waiting list, indices of outcome of medical care and financial statistics, usage of HIS to measure the health status and medical and healthcare needs for local, national and international comparisons of health status for planning, administration and effective management of health services and programs for assessing effectiveness and efficiency of health services, degree of satisfaction of the beneficiaries for research purpose, sources of health information, census, registration of vital events, sample registration system, SRS, notification of diseases, hospital records, disease register, record linkage, epidemiological surveillance, other health records, environmental health data, health manpower statistics, population survey, other routine statistics related to health, non-qualifiable, non-qualitable information, census important source of health information. Census is the total process of collecting, compiling, and publishing demographic, economic, and social data pertaining at a specific time or times to all persons in a country. Registration of vital events. Vital events, for example, live birth, deaths, fetal deaths, marriages, divorce, adoptions, legitimations, recognitions, annulments, and legal separations. Keeps a continuous check on demographic changes. The Central Births and Deaths Registration Act Act 1969 Lay Reporting Sample Registration System provide reliable elements of birth and death rates at the national and state levels. It is a dual record system consisting of continuous enumeration of health, births and deaths by an enumerator and an independent survey every 6 months by an investigator supervisor. It includes birth and death rates, age-specific fertility and mortality rates, infant under 5 and adult mortality, etc. Notification of diseases. The purpose of notification is to effect prevention and control of the disease. Cholera, plague, and yellow fever. Loss-borne typhus, relapsing fever, polio, influenza, malaria, rabies, and salmonellosis. It is extended to many non-communicable diseases like cancer, congenital malformations, mental illness, stroke, and handicapped persons. Some limitations: hospital records, primary source of information about diseases prevalent in the community. Tip of iceberg: disease registers, permanent record to the established of the cases to be followed up, and that basic statistical tabulations tabulations are prepared both on frequency and on survival, exist only for certain diseases and conditions such as stroke, myocardial infarction, cancer, blindness, congenital defects, and congenital rubella, tuberculosis, and leprosy. Record linkage: the process of bringing together records relating to one individual or one family. The records originating in different times or place. The events commonly recorded are birth, marriage, death, hospital admission, and discharge. Other useful data might also be included, such as sickness, absence from work, prophylactic procedures, use of social services, etc. To study associations between diseases. Epidemiological surveillance. Surveillance systems are often set up to report on the occurrence of new cases and on efforts to control the diseases by control eradication programs. They have yielded considerable morbidity and mortality data for the specific diseases. Other health service records of hospital outpatient department, primary health centers and sub-centers, polyclinics, private practitioners, mother and child health centers, school health records, diabetic and hypertensive clinics, etc. It relates only to a certain segment of the general population. Environmental health data. Data on various aspects of air, water, and noise population. Harmful food additives, industrial toxic and inadequate waste disposal.